Okay, and we're away. So today, if it'll let me change the slide. Come on, computer. Why isn't that changing? Let's go now. Ah, there we go. Okay, so today we there's a couple of things. I wanted to start a little bit of an informal chat with you. Well, not an informal chat, but I had a few people email me last week and say after our discussion about, you know, options in public health or where you're going or whatnot, and sort of saying, oh, I don't really know, you know, what is out there or where I want to go in relation to building their learning journal outcomes. So I thought that this week we might actually just start off with a bit of an informal chat about that in groups, and then just to sort of stick with that concept of, you know, what you want to be getting from this unit and also where you think you might be heading. And there's a couple of different people joining us today online, so we might get a little bit of different, you might, you know, chatting to someone different might give you a different idea as well. We're then going to look at evaluation. So evaluation really is the main outcome of your major report for this unit. And it's what we are getting you to when you're on placement, because it's a desktop placement. You know, a traditional placement unit, you would go in and you'd integrate in terms of everyday activities and whatnot, but that might be a little bit more difficult from a desktop point of view. So with the placement organisations, we're working with them in providing a project, public health project, that you then evaluate. So today we're going to look a little bit more deeply at that evaluation process, theories, methods, designs, and how you go about it all, that you can then apply when you're developing your actual project. So we'll go through all those different elements and we'll do a worked example with all of that as well. So that's what's on the cards for today. And it covers all these different learning outcomes in terms of understanding the methodological approaches for public health evaluation, looking at barriers. But before we get started, it comes back to, you know, what you want from this project and all those sorts of, you know, I know some of you are already in full-time work. I don't know if it's public health related or not, and you're hoping to get that CV sort of up and running, because I think that the thing is with public health and a lot of the health fields, it's very competitive when you get out there, and starting to really think about building your CV and where you want to head is probably something that's quite beneficial if you're wanting to look at a career in public health once you leave in the next sort of 6 to 8, 12 months or whatnot. We talked last week about looking at job descriptions and then thinking what you're missing from those job descriptions. But then I sort of got the feeling that people actually didn't even know which job descriptions to look at or where they wanted to go or whatnot. So to kick things off today, oh, look, that graphic sat right over my text. Sorry about that. It says, what does it mean for you? So basically, we'll do our breakout groups again. And I thought we might just have a bit of a 10-minute chat about what does a public health career mean for you? Are you hoping to go into advocacy and policy advocacy? Are you hoping to be global health based? Are you hoping to be, you know, local community based initiatives? Is nutrition your thing, you know, or do you not even know? And maybe some insight from the others might help you with that as well. So with your partner, I want you to sort of discuss about, you're already working in the field and you can talk about that. That might give them a little bit of an idea as well. But I thought that it just might give us a chance to touch base with each other and talk about what it all means for you. Okay. And then also, what learning goals can help you get there, okay? So like we said, what do you want to add to your CV that can help you get to that ultimate sort of public health graduate position you want, be it a public health internship, which can be quite competitive. What do you need to do? What do you want to show your future employee, the skills that you've got, and how can we help you achieve those? So that's enough of me talking. What I'm going to do is break you out again, so just bear with me. I will stop my screen share. Just give me a second. And then we will go break you out. So we might go to 2 to 3 people per room. So I'll just break you out now, and I'll come in and pop in and see how you're going as well amongst those discussions. Okay? You should get an invite now, hopefully. Alex, did you get a little invite from me? Good.